Delusions, echolalia, suicidal tendencies, extreme quietness, isolation, dressing and getting on the streets, among other Ghana Health Service, among others, are what the Ghana Health Service is pointing to as some of the causes or symptoms of mental health problems. We'll be talking through that. MAPS will be joining us as well later with some rather shocking statistics. We'll also explore the family angle, as today, Mental Health Day is marked in a very big way on your favorite show, The Pulse. Now, there has individuals and groups who can possibly do a lot to help themselves, as well as friends and family members who may be suffering mental disorders. Right now, though, let me take you very quickly to North Kanishi, right here in Accra, where Nancy Emefa-Dradosi has been speaking to some young persons who have become dependent on alcohol and drugs.
There has been several research that has been conducted that has been able to establish that there's a similarity between mental health and also which has to do with depression, anxiety, and also drug abuse and substance abuse. Now, today, and particularly the World Mental Health Day, they are focusing their attention on adolescents and also the youth. Today, we are in a community somewhere in the North Industrial area to speak to some of the youth to find out basically from them how they got engaged or enrolled on substance abuse, and and how it's affected them mentally, and whether they want to come out of it or they feel that it's something that they wish to continue. I've been joined by someone who's properly called here this way. Medasi say only ebe twetwe nkomo. Now, first of all, yen sha se na abrabomo eti say ma.
Okay, mommy. Meno dia na kamiyobia na ka mbapa epema sempa. Enso no mapa de me ko school na ma mbapa ne maame awale mbe den etete. Na emo na mna na esa be family ko village. Ama me ko tena me na nchen. Na me na nchen wo tena ni school na me ko no. Na school na me ko na bad boys. Ane ne wo sa school ma abia no o me den. O mo ye wi ho adwuma. No me say about school. Nti mama ho ye den e di me ho koka sa ankrofo no. Although na be dem ho abom so na me ye den na me num nom. Na me nim hweye. Me no nim say me family den e obi. O metuma den. O ma mwa me kura na nka me abetuma den. Afo so abo me so na o say ye den obi ye den. E so me mu ansa na ma ye den. Nipa de on ko ntumi na mo bla obi nka ho. E o so obi ka ho. Tinu amami eden school no kra na mama GSS no kra mama na me call Islamic mama na me call mama so Islamic ama school no kra me do for form 1 every pretty me na me school no me ko biom
mama translate kakra na me sambra biom. So basically what he's saying is that his parents were together and then they later got divorced. And so that was the beginning of his woes. In fact, that is how he tried. He met a group of friends, and he associated himself. Initially, he did not want to partake, in the activities of taking drugs. But then at a point in time, he had to engage in those to come out of whatever he was going through. Most of anything. When meet your friends now more introduce you to drugs no. Yeah. First time fire, how was it like? Weed no. Sorry. It's a muchi ya weed no. Na saying na ope say and try drink free or how be more and I say them putting na what's that say wofa.
Okay, mommy, me start to say omudi mi wula me say me she we no. Okay, me obia bibia no ma kumi mu a me tse bi etumi me na say bi sa anti wi ni kra me share no me huni say we de ma share den enwe say no wi no share utumi feel all right etna si e fa ho adwene kwan ababa so abai den obeyi wodwuma ani si na obe pesika we no entertain say me go for obi ade and I say me go bokro no and I say me go ya ade bon dabi ntɔkwasɛm so deɛ me ukɔ bebia obia nim me obia pemasɛm mempɛ ntɔkwasɛm mempɛ hwee obia so nim me
nti wote asisi ano den moa den na obi beti abeka cho se ade we se me de ma wa ana se me nya me jai win me bi wo wasa obi ka se o de ma wo be ma wo beti me jai
o ene de o mommy me wo obi ka so be boa me no o ka se me jai wi a I swear me jai wi no mommy me ni mo me na me den e ko pe obi moto na bigita e de ye okada edi koi jumaba elema me ne me ba nete me second born oba na dwane jame ntia me ne akura ne kwa nete oba ne de o ma me wo o kumase me ne akura nete me ko kada ansa na ma hwen kwala no
so nya mo na obejai
mo ne de me nya mo ne
iti den juma pa na opese o we ya se sa juma ne de ma wa obejai
oh mommy me de juma de mini ejuma bebre won ma metuma ye ejuma bia ni won ma me adba me metumi ye eno de me apa wo de ka bia de mom bia metumi tu mesumi talent am mesumi ye den ka moto de bia ale me metumi tu
that's it so he just said his final words is that yes, if he gets the job, he's going to stop all that he's doing because he has a family, a lot of them to take care of. And, you know, the burden of taking care of the children sometimes leads him to get addicted to the drugs and he's unable to stop. From the story of somebody who, you know, found solace in weed to take him out of the depression of being, you know, from a broken home. I've been joined by some community members. We just want to share our views on, you know, the mental world, the World Mental Health Day, and how they are dealing with issues of depression, anxiety, with stress, lack of energy, because all of those constitute into mental health, and it's very important to know how they're dealing with it. So let me start with the gentleman to my left.
Ahmed Osman.
Ahmed Osman. Do you have any addictions, and how did you find yourself in it?
And okay, the okay, we know ya journey or the okay home. No question problem the mobile as I say, me na mo ya kra kwa na me jama yo se bia ka ma me bo me bra wa hai. Me no na ba say bi e na ya tete me ye. Ho na me bo me bibia ko wi na me wi na chiri no ko ba sa bla bon bibia bibi ba sa move ya ma do as so ni na enti na ma me involve me ho sa community bibi te me na mo me graduate say no adwuma ba just say
Graduate from Infant
from University of Education Winneba. That was 2016. Yes, IMF dealing, you know, no more employment. And I'm the here. But the BPA as a husband, I'm Tamame, the previous station, you know, the bit said, Sundays, I never be seen them in me, but I have said I'm very involved in the whole Sunday man.
Then specifically, and I push you into it because also you're a graduate. Is this now page you man? I say disappointment. Then putting a leadio into insanum ne yaman then a leadio into it.
No question me a family man. My worry me or baba queer. I can so at least I say me raising it up. So they be that one so be and Gina Bray. Now say me woba na actually I debeche akwa no oba request baby say be an school fees and baby near dey. My men so dey obedi di. What just say na me to ho no ma me ni adwuma ye as a man. Imagine say never be they say me move up na me head there na me see akwa so. Say be do ya yankofo bebre na bet me dey ho aba mo a ade a won fi say won me ye no. Later on no and ma ho ache.
Intisi ano we addicted to den pote.
Me wana mo dey ntwabi dey me fanya hwe ma me no kra ba ko. Me twabi yan kasa me sa hwe. No ka patashi yan kasa la me ka ho asama kire won.
Na den.
And me sa hwe ene dey no kra ba ko. Ba de nyina na me 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 na mo me no bi akwa ba bia ya ye first apata we adwuma sei ba na me say we by name me na we o pa o da fa we about was this year me kire say we about we different time yeah ni nyina gina economy na me my BC basa ya hunu ba be na mo na yesa anka me nya metra bia na ha.
So simply, Ahmed is saying that Ahmed is a graduate from the University of Education, Winneba. One would have thought that from, a very highly institution such as that, he would come out, with a ready job ready for him because he has a wife and a child to take care of. But that is not the case. He has been looking for jobs he couldn't get. And previously, he was not even into alcohol, nor drugs, or weed, or anything of that sort. But because of the depression, because of the lack of jobs, thinking about the stress, he came to Accra to find, to get something to do. He didn't get it. He got to a group of people and they introduced him to weed, they introduced him to alcohol. And in his own words, he's like a master of it. And so he's able to identify, even a seed.
Well, they have been addicted to it. So I can even separate everything for you. Whether they want be the good ones or the bad ones, for that one, I can even separate it for you.
But has taking the weed and the alcohol, has it done anything better? Has it improved your life, for instance? Has it done anything to you?
It doesn't improve any part of my life, but one thing I want to tell you that it does cut what I'm even thinking. It makes it short for me, very easy.
It doesn't make you think?
Yeah, too much. It doesn't make me too much.
I'll come back to you, Ahmed. Let me speak to the gentleman sitting here. What's your name? Ebenezer. How long have you been in this area? And are you also addicted to something?
Okay. Baha answeranche. But na mo baby na me baha. Na me no me all right. But me who say e get to sometime but me who say they dey me connect mo ame. Enti no few time me who free mo. But most wa ha o mo nim say me like we smoke all right. Yeah.
Enti wo jai but yenkasa about then Emma was to say she resisted now or how be and I said then tina odo ho ekowura we num.
Oh, okay. A long story like there I'm will be cry friend breakum. Yeah. Na man like na man father net. Tim father ne ka baby. Tiema living no be so hard am. Nti no me de me ho bo friends bi like na ema nema na ekoso na was me so me join like my joining I won't get something to eat at the end of the day, so I joined them. Like na ye room is ye koye ba ade bi on me bi like na me to na enya me say me de me fam ho nwura but me fam ho nwura ma me na bi na madi ade like e dan ko wi me na bi na madi. I joined them. They on baby and me but now through me like na my dream call they no more yes papa it the sometime that's a me nante months be boss me bebre but na me fa wi ni bi nkoma no ye edrubre bi a na se aduansam no na ehwan eden me say adwuma mo ye no me nso me ye bi na say manya bibi edi I joined them. Tonight I ba like a do baby me say brekum living no emwa me like how the number so we no me to me like me no we no be all right me ba Kumasi Kumasi living no and so be very hard na me brother wa na me brother friend me say me member no me ba I say Kumasi wo ye no eduru ba bi a na nneema bi ekoso a efa wi no ho a like me kono wi na me ye no adwen no koyi ma me me say me jaye e ho no me try like a very hard man me say me jaye but me comport me ho say me timi jaye like me fa kwanya we na fe me dia atu fu kakra bi say so bi wo wi no mo na so pese jaye a very simple mathematics bi o abetimi afada we ni so ejai e yakono na deba akono na ba deba se me kono mwie sa akono no ba ya me media me fa so ejai ne sa akono no ba me teki aduane and the aduane bi besi manim bia no medi bia na makoda me de she madwum mu se megyae nti no kwan bia so mefa so megyae no e wo se mefa so na megyae na metimi eya ade bia ebeboa me life because most machine people be like many omukọ eya like sebio adwen no de metimi aye no huntimi nye sa but bia safo na du no me nduru hoye but me kuta adwen a ese omo de a metimi de aye more better than them but me nya da kwanya no nti no de na me ka se obetimi afa so agya wi no we take food no akopa bia da ye wo hadwen se obegyae Udi like any word so big idea madam
Let me translate it for a moment. So he has been simply put, we're explaining his journey throughout his addiction, how he started. He had issues back at home. His father passed. Life was difficult and living. So he had to find, something to take his mind off it. So he started taking out the weed. But then at a point in time, he realized that, no matter the amount of weed you take, the problem is still there. And you're not getting solutions to it. So he set up his mind that he was going to stop. And he has been advising his friends around to also put a stop to it because, taking it does not really entirely solve your mental health issues. It doesn't take away your depression. And so what he does is that when the desire to take the weed comes, he eats. And then he finds somewhere to sleep.
Me pacho. Me nyine de ma ablabon be den kakra ma me ebra me papa e flee mu jai. Because the from Francis from Pombedu from Kukum Buna Hafo. My father was a great man from Kukum. There ebra me papa be wi no there abusiafo Kukum man hine e me papa e wo faase Kuku man himano me papa enua ba Bible papa wuye no ma me kire se omo mani ankoye ho nti ode afuri kuku mu ho ba sunyan ana yeso de wi aye hu se ma me nko ana ebrehwe no nti na yesi entu kwan me se ba bi na yeso mboa na yehwe ye ho kakra nti no eno na ma ablabo ni ma be wi yesi se baby am here adwumani baby am medani nipa me from royal house from kukum am papa ne dia de kukum eni kwan say basa ti Ghana de ansa boys no ya bla ba be say ama nipa bi ma be no wi me ma ya na fufo no mi sunti kura me hu wi ni bi no me be no wi ni bia kire nya kanam kantini ne madam fu bi am benya no akra oboaboa me kakra ma me kantini enya ba bi gina ya me stop sa no ma ni nyina nka mabla boy basa etese minnuan bi ma me no mo start ya ba akra ha o madane jonki so mo sisi odonim omunum koki omun tramodo omuntimi life no omunhu de ye mo o ma basa se de me so kwan amena mu no anhwe a de wi a me tie no e beduru saa so a me so me life be kwa koka saa na mo ntunu bi.
So he has been recounting how his life has been, explaining to us how he got to where he got to when he got addicted to the weed. And he explains that he's from a royal family in the Brongahafu region. His father passed. The property of his dad was given to other people, as we know it in other, tribes and some of the lineage groups, how they're able to give their properties out. So he's a typical example of that. And so when they moved out from the Bay, they moved to Sunyani. He decided to leave his mom and his elder brother to all come to Accra to come and find a life for themselves so that they can make some money and go back home and take care of their mother. And he unfortunately found himself in a situation. There was no job for him to do. His brother tried to get him a shop to work, but then it also didn't pull out so well for him.
We continue our extensive coverage on World Mental Health Day, and the day has been marked under the theme, Young People and Mental Health in a Changing Health Environment. We bring you all the angles, including conversations with parents, young people themselves, as well as persons caught in the trouble of drug abuse, and some advice on what to do to support loved ones. Now, we'll be joined later by Mapitso Sibidi. She's here to help us go through the numbers. But before we get to all of those rather alarming figures, let's first of all, go find out what we've been learning from the question we asked on Facebook about alcohol and drug abuse. So we said alcohol and drug abuse account for increasing cases of mental health problems among the youth. What can be done to address this problem? We'll get your suggestions shortly. But first, parents have also been sharing an interesting perspective to this whole problem of mental health with my colleague Maxwell Agbagba. Let's check this out.
The general family structure is not healthy. People are living very long distances from where they work, and their children are going to school far away from where they live. This means that the amount of time spent at home as a family is very, very, very short. Now, if such a child is at risk of having an addiction, or there's a risk of taking up some of these substances because...
Psychiatrist at the Ankafo Hospital, Dr. Kwejo Mafu Obain, explaining how, in a bid to satisfy the pressures from work and sending their children to school, parents are being compelled to take their children to school at odd hours. He's warning parents spending little time with their children can have serious implications for their mental health. Some teachers agree. 2017 National Best Primary Teacher Faustina Cops narrates how some parents drop off their children at school as early as 5 a.m.
In that case, the mother was dropping the child around 5 o'clock, 5:30 a.m., yes. And so one of the vendors, school vendors, she actually comes to put up the place, set up before she comes. And so she complained, she made a complaint to me.
So how is this affecting the children's academic performance? Faustina Copson explains.
What normally happens is you realize that they feel sleepy whole day. Sleepy. Any chance they want to just close their eyes and then sleep. Whether you're teaching, whether they have to work, evaluation, whatever, there's any chance they just want to sleep.
However, some parents say it will be difficult to change the wake-up time of their children as they have to beat the early morning traffic to get to work.
5 a.m. in the morning.
Wow.
Yeah. Disturbing. You know, kids early in the morning like that is very disturbing, but then what can you do? You have to wake them up and then see them to take their bath and then take them to school. You have to beat the traffic too, yeah, so that they can get to school early. So it's very difficult, but then that's their future. So there's nothing you can do about it.
You need to understand those things and position yourself, because stress is about the mind. So it is true that you need to wake up very early in the morning, make sure the children are up. It depends on where you are staying. That's one thing I've got to realize. When you are staying outside the outskirts, like Dome and all those places, if you realize that you need to get out of the house before 5:30. Luckily for me now, I'm just at East Airport. So I wake up by 3:34.
And it's one of the reasons I put my kids here, school near my shop. We'll come out in the morning together. After school, they come back. I supervise their assignment to go home together. Because where they are before, I take them to school early in the morning. I come to church, to my shop. Because their school is North Kaneshi, and I'm here in Kotobabi. So around evening time, I'll be rushing to go and pick them. So I noticed some changes. Their academics, the way they play, the ways they're speaking, you know, I know what is going on. Where are they learning such things?
The parents say they are caught between the devil and the deep blue sea, making sure they get the best of education for their children and working to get money to pay their fees. Maxwell Agbagba, JoyNews.
Right then, so Mapitso Sebedi joins me now to help me go through some of the numbers to outline the problem. Maps, good to see you, but let's get started. What exactly are the statistics around mental health?
Okay, so according to the Ghana Health Service, 41% of Ghanaians have a psychological disorder and 32.4% live with a mental disease. So it's 41% who have a psychological disorder and 32% that live with a mental disease.
It's quite worrying. Yeah, so almost half of us have some psychological disorder. Right, so I mean, what exactly would be a sign that a person is on his way to having some sort of mental disorder.
All right, so we've got early signs and late signs. The early signs, it's impaired ability to relate to others, inability to cope with normal stress of life, inability to function, and poor performance. So when you see someone withdrawing from social activities, you know, they don't interact with you as much as they used to, then you can, you know, start to worry a little bit. Yeah, but then when you go to the late signs of mental illness, we've got delusion, suicidal tendencies, extreme quietness, isolation, dressing and getting on the streets, among others. So that's like at the end of it. You know,
undressing on the streets.
Undressing on the streets, and
Scary.
before getting to the suicidal tendencies.
Wow, wow. Right, well, obviously at this point, as we celebrate the days, there's a need for far more education, so we'll be continuing with maps on this later. But these are people who are predisposed, right? Some others have also suffered worse forms and are already in psychiatric facilities. The authorities at the Accra Psychiatric Hospital have been opening up and sharing this with us.
Using marijuana, and my mom said she should bring me here so that I should come and take medication, so that the marijuana will come out from my blood. When I come here, I've been taking my medication as the doctor has said, so everything is going on nicely. So I'm just waiting so that I'll be discharged. I completed secondary school, but I didn't further my education. When I was 16, getting to 17, my uncles, I used to stay with my grandmother. Yeah, so I saw my uncles were doing it. When they go to their farm, they have to smoke a lot before they'll go to the farm. And then when they come back from the farm, they have a certain place, they all gather and then sit down and then they'll smoke. So I've been seeing them. So as in that, I also started doing it behind them with my friends. And then they got to know that I've been doing it, and then we started doing it together. So that was what made me smoke marijuana, but not peer pressure. So me, as for the marijuana, it makes you aggressive. It makes you very, very, very aggressive. So I wish all those people who are involved will go deep into their self, will go very, very deep and be honest to their self, and then they'll tell God to let them stop. Because if that thing is not good and you are using it and it's not good for you, you are the one who is hurting your own body and your own self and wasting your time. So I'll tell them to stop because it's not good for our health.
I'm 17 years of age. 17 years. Yes. Even if it's a day before December, it is still 17 years of age. No, I have not taken it. It is too much learning that has made me like this. Too much learning.
You are learning too much?
Too much, yes. And as a result, it rose my hormone.
Oh, okay.
And God too was with me. I prayed every day. I learned with a dictionary. It was an exceptional thing. To do everyone's thing, you get everyone's result. But to do an exceptional thing, you get an exceptional result. Yes, I hope to go back to school. And if I arrive at school, I'll expose all the gays. After that, I will preach to them the gospel. Then after that, I'll go to the headmaster and I'll tell the headmaster that I have an inspirational words for the whole school. So he should assemble the whole school. I've written an inspirational words for them, and also Ghana as a field state.
I'm here for the past 17 years. Yes, please. I had accident at my workplace, and lo and behold, they said I should go. I went and stayed with my auntie. The condition there, I can't cope with the situation there. So by so doing, it seemed I saw some image, so I developed that kind of goosebumps. So then that's the beginning of my mental illness. So later on, my father brought me to the hospital. They injected me. They gave me medicine. When getting home, my father gave me the tablet in addition to the injection. So in fact, I wasn't on my own. Before I realized I had an attack and I pushed the body down. Later, they rushed into hospital. They said my father is dead. They said I was the one who killed him. So for the past 17 years, I'm in the ward. Within the 17 years, my mother came all along, is a year 2006. Yeah. It came for me. We went to Agbozoma, we went to Georgia, partly Togo, but I came back here. He took me to a prayer camp. But as you know, the medicine that we are taking is not good for fasting here and there, so I came myself. I reported myself here because it's better to be in Asylum than to be changed elsewhere in the prayer, telling you they are making deliverance and whatever.
So you feel that
it's a mental illness. The remedy is taking your medication, nothing apart from that. So if you haven't come here yet, I'm praying that you shouldn't even pray of coming to this place. We should prevent. Maybe it can be a drug, or it can be a drug abuse, or any other source that can bring you here. So I'm advising each and everybody here out there that they shouldn't come here. And if we are falling into this victim already, pray that we come out of it. Yeah. So.
Now, it appears the problem knows no bounds. In our prisons, the problem is endemic. Of course, Dr. Samuel Ajololo is a lecturer at the Department of Mental Health at the University of Ghana. This is what he has to share.
So we are marking this day also to highlight the fact that the mental health issues in those on death penalty has been ignored, specifically in Ghana. Of course, studies across the globe have shown that one of the things that prisoners in general suffer from is mental illness. However, that of those on death row is heightened for several reasons, particularly in Ghana. One, if you are sentenced to die and you are not being executed, there is uncertainty as when you die. And that alone compounds already worsening mental health conditions that you're going through as a result of the conditions in the prison, which include overcrowding, lack of enough space, lack of good nutrition, lack of exercise, lack of recreation. And so we are saying that, look, rather than making this guy going through extra trauma, why don't make you commit them for life? So they don't know, well, once I've been in prison, I'm there for life. Rather than they thinking that they may die today, when in fact they don't know when they are dying. In addition to that, the parents of these people who are on death row also go through a lot of psychological trauma. You know why? Because they don't know when their relative or their loved one will be dead. And so every day in their life they are thinking, when would the day be? And the day is not coming. So rather than making them also go through a long process, which comes back to affect the person on death row himself, we think that we should rather consider the situation of abolishing this death penalty and making these guys serve life imprisonment.
Now, to commemorate the day, CDD, the Center for Democratic Development, has also issued a statement on mental health issues here in Ghana. They say, and I quote, "Today, Wednesday, October 10, 2018, is being commemorated as World Mental Health Day. And the Ghana Center for Democratic Development, CDD Ghana, on this occasion would like to congratulate all mental health practitioners, the Mental Health Authority, and all those who have contributed in diverse ways to ensure that the country's mental health system is running amidst all the challenges." The statement continues, "The World Health Organization lists depression, excessive use of alcohol, drug abuse, stress and anxiety as some of the leading causes of mental illness. The organization again indicates that half of all mental illness begins by the age of 14 and has therefore highlighted the need to help young people build mental resilience from an early age to enable them cope with challenges of today's world." Now, with about 57% of Ghana's population under the age of 25, the focus on the youth in this year's Mental Health Day celebration, which is under the theme Young People and Mental Health in a Changing World, is thus timely, particularly as concerns have arisen over the past few months regarding the rise in abuse of alcohol, hard drugs and painkillers, specifically tramadol, among the youth in Ghana. Now, in the face of the overwhelming number of youth without employment, coupled with harsh economic conditions which form part of the triggers of youth vulnerability to mental distress, it is important to safeguard the future of our country by protecting the mental health of the youth to enable them contribute meaningfully to the socio-economic development of Ghana as they make up a greater percentage of the country's workforce. Now, 6 years after the Mental Health Act 2012, that's Act 846, was passed, the absence of a legislative instrument, LI, to ensure effective implementation of the Act remains a challenge. This, coupled with insufficient resources allocated to mental health care, inadequate number of mental health professionals, and, of course, cultural and traditional factors that impede the efficient delivery of mental health care, total disregard for the dignity and fundamental human rights of mental health patients, and absence of a governing board for the Mental Health Authority should be matters of grave concern, not only to government, but to citizens as well. The statement continues, CDD Ghana is thus adding its voice to call for more attention to be paid to mental health in Ghana. The following needs to be done and done urgently. A legislative instrument should be presented to Parliament as soon as the House resumes sitting to ensure full operationalization of the Mental Health Act 2012, Act 846. 2. Government must provide adequate resources to all mental health centers across the country. With the 2019 budget expected to be read in November, the Ministry of Finance should make sufficient provision for frontline mental health agencies. 3. We must set up a mental health fund. 4. Appoint a governing board for the Mental Health Authority, as well as provide the authority with the needed resources to operate. 5. A collaboration between government institutions responsible for this sector, non-state actors including civil society organizations and the media to educate the public on mental health issues. 6. Increase the number of mental health workers through better remuneration and education. And 7. Double up job creation efforts to curb growing youth unemployment in order to reduce mental health triggers. The statement continues. This day presents a unique opportunity for government and all stakeholders to reflect and take steps to improve upon the existing structures to provide adequate support systems which would aid the delivery of quality mental health care to all citizens. For more information, they encourage you to contact the officers at CDD Ghana Communications Office. And that is the statement from CDD Ghana to commemorate World Mental Health Day.